Delivery of the baby is the end of stage 2. What's the end of stage 1? Complete dilation of the cervix. And what's the centimeters?
4.
Why'd you say that? You know it. You know it. You must.
Okay, and so stage 2 is delivery of the fetus, the baby. And stage 3?
Placenta.
That's right.
And then when the placenta comes out, what do you do with it?
Put it on.
Yeah, massage
No.
the fundus.
No, didn't you put it in a plastic
examine
bag?
it. You examine, did she not
Oh,
go
to see
through that with you
yeah,
guys?
to see if there's any pieces.
Many missing pieces of
Yeah.
the placenta. So
Yeah,
what
that's
if there's
right.
some pieces, some chunks of the placenta? The placenta on one side is smooth, like this really shiny, wet balloon. It's really, actually pretty cool. The other side, it's not as romantic. It's really rough. That was the part that was attached to the uterine wall. It's really rough, and it's like a whole different movie on the other side. It's not that easy to see sometimes if there's anything missing out of it. But flip it over and have give it a few seconds look. What if there's some shit missing from the tissue missing from the placenta? What do you do? What does it mean if there's something missing?
It's still inside.
So that's still retained, maybe even attached to the uterine wall. That's an opportunity or vehicle for blood loss. Okay. And then you know that you did this with your hand. So postpartum blood loss, you do a couple of things. You massage the fundus, right? Fairly aggressive kneading. And then the other thing is baby to breast. And the reason for those things is trying to stimulate the release of oxytocin, which in fact does what to the vasculature?
Constricts the
Good. Preeclampsia, what do they look like? Signs and symptoms.
Hypertension, headache,
That's it.
visual abnormality.
Good.
Elevated protein.
Proteinuria.
Yes.
Got eruptions. Is this helpful, or is this, hopefully it's, you say, yeah, I know that, I know that, I know that. Okay. The kid comes out, literally, baby's delivered in your hands. What's the first thing you do?
Apgar?
No.
Apgar.
Apgar, you know, I'm almost having, people have to remind me to do the Apgar. That's how important I think it is.
So that
Mm-hmm. I do like the equivalent of what's a primary exam on a neonate. But yeah, the Apgar, you know, you're just showing trends, which is important. But, you know, if you otherwise weren't locked into the kid, it's kind of like sample. It's like, yeah, you know, it's not the worst idea. But kid comes out, what do we do?
Clean?
NRP? Or no,
Did you say Apgar again?
no, I
Did your
said
sister?
NRP.
NRP? What
Kind
you
of the
do
same.
is position, warm, dry, stimulate, suction as needed. As needed? Does every kid need suction?
No.
Which kids need suctioning?
Yeah.
Kids with a bad airway or respiratory distress. Okay. That's what you do for every child. Give the kid its due. Now the kid's, you know, thriving, kicking, good color, robust cry, heart rate over 100. You know, the kid can go to mom. But your kid is not doing any of those, and the kid has a heart rate of 80. What do you do?
Check there.
After you do your initial steps, the kid's heart rate's 80.
Check.
Lethargic.
Low by.
You know what, let me help you with the blow-by, because it gets kind of put in the algorithm, but not a lot of detail behind it. Here's who you get blow-by to. The kid's got a good enough Apgar to go to mom, but still blue extremities. That's who you get blow-by to. The kid with a heart rate less than 100, you're squeezing the bag. 60 to 100, I'm telling you, ventilate that kid. Remember, bradycardia in pediatrics, that's an ominous sign, it's a sign of hypoxia. And this kid, again, I mentioned it the other day, never exercised the lungs before. 9 months, breathing for a neonate is 40 to 60. It's a normal heart rate. Just-
140.
Yeah, so in utero, like 120, 160, normal before the delivery, but, one way of thinking about it is what's our cutoff is 100, right? So anything over 100, we're happy. Almost like a different language, right? Kids, they're neonates. Lots of questions on head trauma. Nothing really intricate, I don't think. Yeah. I'm just gonna take a look. Head trauma, chest trauma. Kids, there's just a few things, and hopefully I'll pull them out, but the kinematics of trauma, like the energy. I'm not a big fan of those questions, I don't think I get enough out of that. But, kids turn away from a car that's about to smash them. Adults look into the car. Here's the other way around. Yeah, kids turn away, we look into it like, ah. I think there's only one question on extremity trauma, so you want to know just review the definitions of like fracture, dislocation. How much blood can you lose? I mentioned this to you before. How much blood can you lose in a big pelvic fracture? It's got to be in your book. How about a femur?
1 liter. 1 liter to 1.5 liters of blood loss.
In each femur?
I thought
Yes.
Look it up. It's not that. That's so if you had 2 femur fractures, you could lose up to 3 liters, and that's over half your circulating volume. That's not the way it works. So it's too much. But look it up. How much blood in each blood loss in a femur? It's in your book.
I thought it was 1,000.
Look it up. Abdominal trauma, there's a lot of abdominal trauma stuff in there. You get stabbed in the abdomen. What are we worried about?
Solid organ damage. I mean, hollow too, but solid first.
Tell me about bleeding in the abdomen. That's where we're always worried about first, right?
Yeah.
Solid organ, what solid organs are in the abdomen?
Liver,
spleen.
spleen, kidneys,
What else is in there that's not an organ, but it's vasculature?
aorta.
Aorta, so you have the abdominal aorta, you have iliac, maybe femoral. Okay, name some, so that's the big deal. What about in hollow organ rupture? Whether it's ruptured or stabbed?
Infection.
Yeah.
What's that infection called?
Peritonitis.
What's the peritoneum?
Peritoneum is the outer lining of the
And would you see that in the field?
Yeah.
That takes like, not today, you're not. You
It's like- it
may
takes like
start seeing
6
that
hours.
tomorrow, yeah.
Yeah.
Okay, and name some, hollow organs in the belly.
Stomach.
Stomach, all that 25 feet of bowel, right?
Fallopian tubes.
Yeah.
Fallopian tubes,
And this pancreas.
ureters.
gallbladder,
Bladder.
yeah. There's questions there's a few things on Cushing's, so read up on Cushing's one more time, read up on Beck's one or 2 more times. Sub-Q emphysema. Rule of 9s is on there. I'm not gonna put any burn chart. I decided, no baby, no child, no adult.
Number.
You'll need to review that prior to registry, that I'm not gonna put it on here. There's definitely a burn, you have to calculate a burn. And then, how much is the hand?
One.
One.
What about a Vulcan hand?
One.
Okay. Which part of the brain messes with when pressure is applied to this part of the brain, it changes your vital signs? more specific.
Odds.
No,
Medulla?
not that, I'm sorry,
Medulla?
medulla.
Yeah.
Medulla.
No, that's the.
It's not good, but it's something that they ask. Medulla, what's the?
What's she saying here?
Trauma centers, what is somebody shot in the abdomen and they have a rigid abdomen. So rigid means this, you palpate, when you guys are doing your skits, I say soft, non-tender, non-distended. Yeah,
Hardy?
this is not soft, right? It's hard. So that's a rigid, so what does that mean?
Just blood.
Blood in the
Blood, there's
abdomen.
blood in the peritoneum. So you have your patient, they're in shock, whatever that means to you. You should know because I think it's a fill in the blank, define shock. But they have a rigid abdomen and there's trauma suggesting they're bleeding into the belly. What's ultimately what we want for that patient? Where do they need to go?
Surgery.
Surgery. So just always remember in everything, not just this example, trauma is a surgical disease. As fast as you can get them there to their appropriate level 1 or 2 for trauma center, that's what we ultimately want, okay? Blood pressure, low blood pressure, early sign, mid sign, late sign?
Late sign.
For everybody or just kids? I have an injury to my neck. I got lacerated. Somebody whoosh, and just got me like right across here. What are you worried about?
Emphysema.
That's your number one?
Bleeding as well.
Carotid.
What else? So you would see that. Carotid's gonna be spurting.
Yeah.
Yeah. We'll just say if there was like the tissue was covering the spurt, that swelling would be profound because there's that much blood loss, right? Every time my heart beats, you get like whatever, 50 cc's of blood. Yeah, it's gonna be massive. What else? So carotid artery, you mentioned jugular. What else?
Emphysema.
Just sub-Q emphysema. So which artery is that? That's the trachea. So you want tracheal disruption. And then lastly, if it was a deep plunge, what else could you think about? Spine.
That's right.
And if it were a carotid, how are you gonna fix that? I'm spurting out of my neck.
You try to
Blood
pinch
tap.
on it or you put a finger on it?
There's no pinching. I don't know where you got that, but if you take a little bit of gauze and go right into the wound and get right on target. Don't mash it, don't press on it with your hand and crush the trachea and the spine. It's really finesse when it comes to the junctional wounds, all of them. But this is grabbing gauze, by the way, when I do that. And then right in on. And I make it sound like it's no big deal, but my tip of my finger, that's bigger than a 9mm hole. So you may see where it's coming from, but try to get it in there. Don't make the wound bigger. See it rack further. I used to have this knife. It was kind of like a hook. You could take the wound in the neck, and if I couldn't get gauze in there, I could take don't tell anybody. I would take it and I would pull the tissue away. I'd open up the neck to its bigger hole, just the skin, so I could get more of my fingers in there. Just people walking around with not a great scar, but they're alive. They're alive to get you in there. Okay, so direct pressure for anything that's bleeding, but certainly for a junctional wound. And then what about the venous bleeding of a jugular? What do you do for that?
Same thing. Pressure.
Same thing, it's gonna be direct pressure. What if there's a hole in my neck and it's not bleeding a lot, just a little bit? Or you put direct pressure on there for a few minutes and now there's no more bleeding. Now what do you do with that next one? What kind of dressing? Occlusive. What do you have for that?
The seals. Chest seal.
So you're gonna take a chest seal, put it on my neck?
Oh, no.
Yeah.
Yeah? How are you gonna do that? You gonna slap like the whole side of my face with a chest seal?
Can you put it?
Vented or not vented?
Not.
It's a trick
I
question.
was gonna say, can you do
But-
this?
But we don't really,
Wait,
we
because
don't
it's
really
occlusive.
take it out to its endpoint, do we? Like,
No.
really? You know it works really good? Any kind of like window pain, you know, like, when we do start the IVs, we put that little thing on there? That
Saran
Tegaderm?
wrap.
Yeah, Yeah, that thing is perfect. Just you're not allowing air into the vasculature, because if you got air into that jugular, that could potentially, it's an air embolism. Embolism just means moving clot. Clot could be air. So where's that air gonna go? Well, it's gonna be going this direction, so it's gonna go in my heart.
Yeah.
And it might get caught in the lung somewhere, cause a pulmonary embolism. Or it could go to somewhere in my periphery. It could be in my forearm or my leg, and it's gonna cause occlusion to the vessel. All of that was for one question. You get somebody cut in the neck, would, stop the bleeding, and then occlusive dressing. If you were to use the occlusive dressing that you're talking about for the chest, cut a piece of it off. Don't be ding dong about it. All it's gotta do is stick, right? Easier said than done with all the blood to get it to stick. A lot of ICP questions, you guys. Remember to really look at that. Cushing's. Dun, 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 dun. There's a couple questions, like in the first two chapters, like your EMT license. Yeah. So take a look in your book on your EMT certification licensure. What's it designed for? Getting licensed. What does it mean? It sounds kind of vague, doesn't it? We get licensed in things so that, there's a standard that you're meeting. So like the government or whoever that body is, they establish a standard, and by getting licensed, we're testing it, we're all essentially doing the same thing. But you should look at it. Consent and refusal, I mentioned that before, have a look at that. Most of this stuff's common sense to you, it should be by now. Just don't read too much into it. Here's one thing that you need to look up. Glucagon, it's a fill in the blank. Glucagon. Where is it produced? Where is it stored? What does it mean? If you just know where it was produced and where it's stored, I'm happy with that. Why? Because that's what the question is.
Is produced and stored and what else?
Where it's produced and where it's stored, yeah.
Okay, it's 4 o'clock. I've got a few, I'll get into it tomorrow. I got a couple pretty in-depth, like the whole page for extra credit on a scenario. I can tell you right now that,
Is the extra credit on the final?
oh God, yeah. You're welcome, by the way. I don't know if I put it in there for me or for yourself. Okay. Want an example?
Yes.
Okay, this one came from a previous final. Maybe it was even Moises. Okay. This isn't a long one, that's why I'll give it to you. This is a shorty. You find an elderly man unconscious in the restroom at a local eatery. He's pale, cool, and diaphoretic. You got the mental picture? Old man unconscious in the restroom at a restaurant. Pale, cool, diaphoretic. What does that mean to you?
Skin cells.
Sounds shocky to me. That's what doesn't mean he is, but that's where I go with it. Heart rate is 36 beats per minute. Big deal? Not a big
36?
deal? 36.
Yeah, that's
Heart
not
rate?
big.
Yeah.
That's
Yeah,
not-
but he's old.
Oh, yeah.
His blood pressure is unobtainable. So that means there's no radial, no brachial. Can't get it, if there's no radial or brachial, you can't get a blood pressure.
No carotid?
I'm sorry?
No carotid either?
Doesn't say that. It says no radial or brachial. After 10, his breathing's 32 and shallow. Big deal? Not a big deal.
That's a big deal.
After 10 minutes, the man is responding to you and now has a heart rate of 70. After 10 minutes,
Is
okay?
that-
You ready? I'm not done, but that's your skit. Old man, I'll even help you out with it. I don't put it in here, but on the toilet, straining at stool, falls out. There's no trauma unless you ask about it. You don't ask, that would be something, but anyway, so basically the guy has a vasovagal response. Like he's pushing and so hard that you increase the pressure in your chest, it stimulates that vagus nerve, one of your cranial nerves, which has to do with your heart rate, your SA node,
That's why it's a
and it slows it down. Slows it down to 36, not enough blood going to the noodle, and he's down.
And he's on Blipton.
And then he's pale cold diaphoretic because his blood pressure dropped. So you guys get there now after 10 minutes, it gradually starts coming up in the supine position. So that's not the question, that's just what happened. Okay, what type of shock is this?
It's 2 minutes. Cardiogenic shock.
Would he have big bowel movement and scared the shit out of him?
Fuck yeah.
Heart, what's his heart rate again?
36 and then went to
What kind of shock
70.
is it again?
Cardiogenic.
Thank you. Really, really slow or really, really fast can lower your blood pressure. It's heart related. It's not a muscle related, but it's rate related. Because remember, heart rate times stroke volume.
Yeah.
Yeah, okay. And the condition is referred to as vagal what?
Stimulation.
Los vagal, Viva, Los vagal, vaso, like vascular, vagal response, or vagal response is fine.
Vagal response.
And then the last part of that, so there's 3 questions. What type of shock, what's the condition referred to, and what's the mechanism behind it, which I told you. Straining, stimulate the vagus nerve, subsequent reflexive bradycardia. These are really common, you guys, these cases. I've had people, it's usually on the toilet. I've had people standing at a urinal. When I say people, I mean old men. I don't think I've ever had a woman vasovagal. Urinating, defecating, coughing forcefully, and the keeper, which is a one-off, I can't remember his problem. Little tiny guy, we're doing a real fast sit pick with him out of his house in Montclair, because we knew we had like 15 minutes. He's dying of some cardiac event. It's winter night, really cold, and I'm sure I didn't put anything on him except he's wearing his cute old guy jammies. So I'm holding from behind. As soon as the door opens, he gets that blast of cold air. It's kind of like having cold water in the shower. You kind of do one of those numbers. Well, your epiglottis closes, and then you tighten up your chest, and all of that back pressure stimulates the vagus nerve. Yeah, he was unconscious by the time I got him on the gurney with a heart rate of 24.
From cold water?
Cold
Cold
air,
air.
just from the air. I felt